My name is Ben Florsheim. I am mayor of the city of Middletown. I first found out about Mindmap and the STEP clinic a little over 10 years ago when I was just starting out as an aide to Senator Chris Murphy, who at that time had been relatively recently elected to the Senate. Um, and after having been stymied on efforts to change gun control laws in the wake of the Sandy Hook shooting, and also out of a recognition that came from his time in the legislature here, um, of the deeply flawed and broken network of support and just general system that we have for mental health care. Um, on these two separate fronts, he was sort of trying to answer this question, which is kind of a canard, but answer the question posed, well, why aren't we doing anything about mental health? Why are we talking about guns and not talking about mental health? His response to that, our response, is that you need to do both. And fortunately, we've seen progress on both of those fronts in the years since. Um, but but to take that question seriously, okay, let's try to do something about the fact that our mental health system is not working for the people that it's designed to serve, the people that it needs to be serving. Um, so he decided to write legislation, and the starting point for writing legislation was trying to talk to experts in our state and around the country about what would be effective, what could be achieved, what could be changed, um, and what are the models that we can look to base that change on. Um, the early intervention around psychosis is something that we quickly realized was a hugely successful and important model to point to, and the work being done out of Yale and with Mindmap was something we wanted to highlight. So I came to this from that standpoint. It was something that we understood was working and could be scaled up, could be provided with more resources. And the huge piece that was an eye opener for me was understanding psychosis not to be the underlying condition, but to be the expression or the symptom of the underlying condition, whether that is a chronic mental health illness, whether it is a substance use issue, um, and recognizing that just like anything else, the earlier you catch it, the more effectively you can treat it. And trying to bridge that gap of okay, how do we bring to bear resources to make that possible? How do we reach the population that we need to reach to make that possible? Has been the work, in part, the work that's been underway for the last 10 years. Another eye-opening and productive part of when we were writing, when Senator Murphy was writing that legislation, one thing that made a huge difference was just getting a lot of different experts into the room to be talking about these things. Whether it was we were just sitting in a room that was full of clinicians, as well as peer support people, recovery coach type folks who have been through the system themselves and are not coming to it from a clinical perspective. We also had law enforcement in the room. We also had, civilian staff from the city and from the police department in the room. It was similar to a lot of the rooms that we were in, again, 10 years ago when we were trying to have that conversation. And the reason I say that is you had a lot of people who were working sometimes right next to each other, literally or metaphorically, but weren't talking to one another and didn't know, that didn't even think of themselves as a resource to this colleague, to this peer. But once a person in the police department hears a clinician talking about something that rings a bell, or vice versa, we were able to get a lot of interesting solutions, a lot of dialogue, a lot of collaboration out of that. And so when I first took office, shortly after I took office, the local mental health agency, River Valley Services, approached the city It's a state. This is branch of a state agency. They had some additional funding that they wanted to put into place by bringing in embedded clinicians who would work within the police department, within the Middletown Police Department, and would essentially be on the front lines with the first responders, be a first responder themselves, to people who were experiencing mental health crisis, or to people who, through whatever interaction with the police, seemed like they needed support rather than prosecution, or they needed support um, rather than sending them to the chamber for job training or something along those lines. They needed clinical attention. Um, and I was really excited about that because I knew from my own experience and background that it was proven to work. That if we had that resource in addition to our law enforcement resources, that it would make a big difference. And that was my expectation, and it has borne out that way. We have had a couple different folks now who have come through and been in the police department working with us from River Valley. We have data showing that we are significantly reducing use of force. We are seeing lower crime to begin with, especially when it comes to the types of crimes and justice interactions that come from psychotic episodes or come from persistent mental illness. And most importantly, in a lot of ways, we're seeing people who are getting into treatment and getting help, getting housing, getting care. And the latest step that we have taken, having seen the success, is in addition to these clinicians, we now have working at the police department non-clinical caseworkers. So these are folks who are PD employees, but they are not police officers and they are not mental health providers. They are caseworkers who work with individuals in the community, who work with this crisis intervention team, who work with the officers to help people with the follow through, essentially, to make sure that when services are difficult to engage with, that they can help to bridge that gap. They can create a record that is designed to keep people out of incarceration, keep them out of future justice involvement, and keep them off of the streets, right? Keep them on track and supported in whatever way they need that support. And that's a program that's just getting underway, but it's just another leg of this table that we're building to try to help keep people on the right track, to make sure that, to the extent that resources are there, they're not always accessible for everybody. And we are trying to make sure that accessibility is not an issue in the city of Middletown, even as we recognize there needs to be more investment nationally and statewide in building up those resources themselves.
Yeah. So
It's true that we're starting to see reduction in stigma and reduction in because I think that people are starting correctly to uh, identify, or people are starting correctly to see stigma as what it is, which is discrimination. And it's treating somebody differently because of a health condition, no more so than treating somebody differently because of a physical disability. And it's part of what has made that so difficult to overcome is that a lot of the time these conditions are invisible, and they're being talked about more. Awareness is really important, although it is not the solution in and of itself. But having people understand the signs at a community level of what mental health crisis looks like is a huge key part of reducing that stigma, of reducing that discrimination. Um, Psychosis is a s- the scary thing, right? We think about um, mental health, mental illness can be all sorts of different things, and uh, people might not be alarmed when they hear that somebody is diagnosed with depression or with an anxiety disorder. or even with a personality disorder or bipolar disorder, the things that are being treated with medication can be treated with medication, can be managed in many, many ways. Um, when people hear psychosis, they think of somebody who is lost control of their ability to interact with reality around them in a way that is safe for themselves or for people around them. Um, it is the moment when invisible conditions become visible to their peers, to their family, to anybody who witnesses somebody having a psychotic episode. Um, it can be a very scary thing. Much of the time, not because you're worried for yourself, but because you're worried for the person experiencing that episode. Um, the the key revelation for me and I credit Mindmap for helping me understand this, is that psychosis is a symptom, not a disease. It is the expression of a mental health condition or of the use of a substance, rather than the underlying cause itself. If you don't have psychosis, you have a disorder that can cause psychotic episodes, and that just like any other disorder, um, the sooner it is identified, the sooner it can be treated, and the sooner that it is treated, the more effective the treatment is. So understanding that if I have asthma and I don't have my inhaler, I might have an asthma attack. And if I do have my inhaler, I can head off that attack by taking my medication. If I have a mental health condition that has psychotic episodes as one of its expressions, um, I might have a psychotic episode if I'm not in treatment. If I whether because it hasn't been identified, or I haven't had the resources, or my community it doesn't have programs like this that help me get to those resources. If the treatment is not happening, the episodes are also going to happen. The expressions of that underlying condition are also going to happen, and it really is no different from physical to mental. It's all physical, right? It's we're all uh, and just obviously a lot of these conditions that we're talking about are co-occurring with other circumstances, whether those are other underlying health issues, and oftentimes socioeconomic factors, factors that are going on in people's lives beyond their physical and their mental health. We have to understand, um, as providers, we have to understand as community members the distinction between what is visible and what is not visible, um, is kind of a false one, um, and that's an easy enough thing to sort of say. Um, Trying to get people to understand that is more challenging. What we can do in local government is things like what we're doing in our police department. We can see if this early intervention strategy works at the local level. What we are seeing is that it is working. And the way that people experience that as community members, they might not have any more sophisticated understanding of what psychosis is or what mental health resources are available than they did before. But they will also be seeing that their community is safer, that the police department is arresting fewer people and helping to get more people into treatment. Um, and just by doing the things that work, we can reduce the stigma by reducing the incidence of people who are finding themselves in crisis when, in fact, treatment is available to them.
Yeah.
I was doing research recently on poison control, in our state, which is not something that's handled at the local level. It's handled statewide. And if and parents know this, and most people know this, that if somebody ingests a poison, if somebody if there's a toxicity issue, there's a number that they can call 24 hours a day, and get immediate expert medical advice, to say you need to go to the hospital now, or you need to take these steps, or you don't have anything really to worry about if this is what happened. And we are trying to make sure that those resources also exist for people in mental health crisis, or not even in crisis, but looking to try to get care, or looking to understand what their options are. We have a number here in the city of Middletown, our mental health resource center, that people can call to try to get navigation services. Like I said, we have folks in the police department who are helping people follow up if they've had interactions with police. But what they really need is mental health care or other services as it relates to housing or things of that nature. Creating these resources where there's a number to call, not just Google something and see what the first result is, but actually talking to a trusted expert, is something we need to continue building out in our state. And having this Mindmap resource for everybody in the state, where they can make a call, get a call back within 24 hours. It would be great, and I'm sure that the folks running it feel this way, when the resources will hopefully someday be there where you've got 24/7 full-time staffing. But speaking from the municipal government perspective, we can we see the need, and we see that the resources are just not there to meet that need at the level that it exists. And that's also part of this stigma conversation. It's also part of the resource conversation. We've got to get to a place where the resources are there for the immediate intervention, for the immediate response. But again, that's all premised on this notion that the earlier the intervention takes place, the better the outcome and the results are going to be. And we have gone in the last 10 years to having nothing in this space to having now a resource in Mindmap that is going to allow people to navigate this system a lot easier than they would otherwise be. So for the community to be aware that this is a number that they can call, that it is a website that they can visit, and then that they will get results, is something that is just invaluable. And it's something that we are going to shout from the rooftops in Middletown, just like we've been doing for the other resources in our community.